Today, we're going to continue on with our pediatrics review. We're going to be covering cleft lip and palate, as well as going through about 10 questions and click style questions to help you answer these questions correctly. So stay with us. It's coming right up. Hello, Clinic Review families. Dr. Sharon with Clinic Reviews, and I am doing a series on pediatrics. I had intended to not do the blue book, but a lot of the content that I want to cover in pediatrics is in the blue book. So we're going to get out of order a little bit. We had been kind of going pages 1 through 15, 16, 17 in order, but I'm going to be pulling out some of the pediatric content in the blue book. And so today we're going to be covering cleft lip and palate, and that is on pages 170, 171, and 172. So I have the blue book open here for me, which is why it looks like I'm doing some weird stuff. So the Clinic Reviews is the very best NCLEX review in the entire universe, in my opinion. We also do small group tutoring. If you're interested, go to clinicreviews.com. So if you go to page 170, you can purchase the blue book on Amazon. I don't make any money off of it. If you go to page 170, you're going to see cleft lip and palate. So before we start doing questions, let me talk just a little bit about cleft lip and palate. So a cleft lip is when the lip is open to the nares up to the nose, right? So the cleft lip is open to the nose. A cleft palate, remember the newborn doesn't have any teeth, so it'll just be their gums. The palate is actually open to the nasopharynx. They can have both. It is possible to have both. The issue with a cleft lip is it does make it difficult to nurse, and it's much more difficult to feed a baby with a cleft lip. The issue with a cleft palate is you want to get it corrected before permanent teeth start to come in, because it can alter tooth development. The issue for both of them is they're more likely to swallow air. So you want to do frequent burping with a baby who has either a cleft lip or a cleft palate. They can have both. The cleft lip, because it does alter or impair feeding, they will do it earlier. So somewhere between 2 months and 6 months, they're going to repair the cleft lip. Cleft palate interferes more with tooth development. And so they're going to surgically repair that somewhere between 1 and 5 years old, usually closer to the 1 year of age is when they're going to do the cleft palate. And it does require 2 surgeries. I'm not quite sure the specifics of all of that, but mostly they're going to test you on when they do the surgery. They say, when do you do the surgeries? Around 1 year old, somewhere between 1 year, 12 months and 18 months. The second surgery will be done before any permanent teeth come in, just to make sure everything is repaired correctly. So let's go ahead and get started with our questions. And I'm going to be doing some teaching while we do the questions. So that's why I'm doing it this way. The parent of an infant born with a cleft lip asks when this will be repaired. What is the nurse's best response? At birth, during the first 6 months of life, between 6 months and a year, between 1 and 5 years of age. The correct answer is B, during the first 6 months of life, not immediately at birth. They want the baby to grow a little bit, gain a little bit of weight before they do it. Question 2, the parent of an infant born with cleft palate, asks when this will be repaired. What is the nurse's best response? Has the same answers. And the correct answer for this will be between 1 and 5 years of age. That encompasses both of the surgeries. So the first one will likely be around 1 year of age. The second one will likely be between ages 4 and 5, somewhere in there. Okay, if you're wondering where question 3 went, I skipped it and edited it out. Okay, question 4. The nurse is caring for an infant with an unrepaired cleft lip and palate. Which measure would be the most effective in helping to retain oral feedings? I know D is not right. We don't want the baby to be supine. So they have both a cleft lip and a cleft palate. So I know A is true. Now it says, which will be most effective in helping to retain oral feedings? So will frequent burping help them to retain? Well, if they're swallowing a lot of air, I would think that if they're constantly burping, especially a young newborn in the first several months or first 2 months, because they got both a cleft lip and palate, I would think that if they're frequently burping, they're frequently regurgitating up what they're taking in. So I would think that burping them would help retain oral feedings. Feed the infant small amounts at one time. Will that help them retain oral feedings? I don't see how that will help them retain oral feedings. Just small amounts. I don't think so. Place the nipple far to the back of the infant's tongue. Well, that wouldn't do anything to retain oral feedings. And in fact, I would think that that would be sort of choking them a little bit. Okay, so this is not a question that I think, oh, I immediately know the right answer to this, but I do know what a true statement is. I know A is true. So I look at the other ones and I may be uncertain about the other ones, but I always pick the answer I know for sure is true. And I know A for sure is true, which means because I'm uncertain about the other ones, or I could be uncertain about the other ones, I'm not going to pick an answer I'm not sure about over an answer I am sure about. So remember that when you're answering questions. Question 5, after surgical repair of an infant's cleft lip, okay, cleft lip, the nurse teaches the parents about proper use of the Logan bow. Which of the following statements indicates the parents understand the discharge teaching? I will leave the Logan bow on at all times. I will make sure to remove the Logan bow periodically and provide active range of motion. I will remove the Logan bow during feeding. I will clean the incision site with iodine before reapplying the Logan bow. Whether I know anything about Logan bow or not, I'm not going to pick D because I never clean incisions with iodine. Iodine kills cells. That's why we clean the skin with iodine before surgery so we can kill all the bacteria. But if you clean an incision with iodine, and y'all, we used to clean stuff with iodine back in the day, it's sort of freaky now that we used to do that. But if you clean an incision with iodine, you're starting to kill all those cells that are healing. You kill all the healing cells. You don't want to do that. So I'm crossing off D. All right. So let me tell you what a Logan bow is. A Logan bow actually helps keep the incision together. So it's actually shaped like a bow and arrow, right? So if you have the string here and the bow is here, it's like the bow side goes around the baby's head like this, and it actually pushes the lip together like this. And so it helps that incision stay together so that it can heal faster. Okay, so what's the important thing to do with this? I will leave it on at all times. I don't see why I would leave it on at all times. They have to feed. That would make it more difficult to feed with the Logan bow on. I will make sure to remove it and provide active range of motion. It has nothing to do with range of motion. It doesn't impair range of motion at all, so I'm crossing off B. I will remove the Logan bow during feeding, and that is in fact the right answer. It is in the blue book. So you take it off during feeding. You can clean the incision and with some hydrogen peroxide saline mix. 6, a 2-month-old infant with a cleft lip is scheduled for surgical repair. So they haven't been surgically repaired yet. What is the nurse's priority pre-op assessment? Assessing the infant's weight and nutritional status, checking for signs of respiratory distress, evaluating the family's understanding of the surgery, ensuring that the infant is free from infection. So here we have a prioritization question. So it's what is best? And we've talked about prioritization strategies. One of the prioritization strategies that I talked about was ABCs. And I said, when you have 2 physiological assessment data points, and they say, which one is your higher priority? 2 objective physiological data points. You are allowed to use ABCs. Now, if ABCs doesn't work, like one of them is an airway breathing or circulation, if that doesn't work, I would go with acute versus chronic. So in other words, I'd assess the acute problem before I'd assess the chronic problem. Nevertheless, I see this and I go, well, I would definitely want to assess their weight nutritional status before surgery. I would definitely want to check for signs of respiratory distress. I would want to evaluate their understanding, and I would want to ensure that they're free from infection. The C, the evaluating the family's understanding, I'm crossing that off. To me, that's not the priority because I want to choose some physiological objective stuff on the baby that I'd want to actually assess. So let me look at this. Assessing infant's weight and nutritional status versus respiratory distress. Well, respiratory distress is ABCs, right? ABCs is airway, breathing, circulation. And even though I know weight nutritional status is important, I've got to choose the airway, breathing as the higher priority. So I'm going to go with B. I'm going to cross off A. Now, I would want to assess to see if they're free from infection, but is that airway, breathing? It is not. And so I have to prioritize the respiratory distress. Now, this is not the same as saying, which are you going to call the doctor about? You call the doctor about the unexpected finding. You don't use ABCs when it says, which are you going to call the doctor about? The only time you use ABCs when they say, which are you going to call the doctor about, is if you have 2 unexpected findings and one of them is airway, breathing. All right. Then you can use ABCs. You always call the doctor with the unexpected findings. In this case, it's saying you're going to assess what. So I'm going to prioritize assessing airway breathing. 7, a nurse is providing discharge teaching to the parents of a toddler who had cleft palate repair. So toddler had cleft palate repair. Which of the following instructions should the nurse include? Use a straw for feeding to prevent trauma to the surgical site. Absolutely not. I don't know that much, but I know you're not supposed to use a straw after cleft lip palate repair. Offer solid foods as soon as possible to promote healing. That does not seem like a good idea to me. There's ways to promote healing without having to offer solid foods. That doesn't seem to make sense to me. Administer pain medication only when the infant is crying. No, I would think that I would want to give it sort of around the clock to prevent pain. Rinse the child's mouth after feeding. Well, that seems like a good idea, because if you've got incision in there after they eat, then I would want to rinse the mouth. They may be too young to rinse it, but I could use a moistened toothette and rinse it for them. Question 8, the nurse is preparing to discharge a toddler after cleft palate repair. Which of the following instructions should the nurse provide to the parents? Use a straw. No, I already said no to that. Encourage the child to use a pacifier. Now, this is one where I say no pacifiers. They've had a mouth surgery. Pacifiers, bad after that. Offer soft foods and avoid hard objects. Well, that seems like a good idea. Allow the child to eat regular foods. I wouldn't think so yet. After surgery of the mouth, just common sense, y'all. I'm just showing you that you can answer NCLEX questions using common sense. This is not the hardest test you're ever going to take. The NCLEX is not the hardest test you're ever going to take as it relates to content. So the content is not super high level necessarily, but you have to know how to read the question and interpret it. That's why I talk a lot about testing strategy. But you have to have the knowledge as well. You have to understand the facts, which is why the Blue Book is so important. Question 9, a nurse is teaching the parents of a toddler who had cleft lip repair about the use of elbow restraints. Which of the following statements indicate the parents understand the discharge teaching? We should keep the elbow restraints on at all times to prevent our child from touching the surgical site. We will remove the elbow restraints every 2 hours to check for skin irritation and allow movement. The elbow restraint should only be used during the night while a child is sleeping. We can remove the elbow restraints if our child seems uncomfortable. Well, even if you do not have any idea what an elbow restraint is, y'all, you should still have picked B, because anytime we apply any kind of restraint, we should always remove it every 2 hours to check for skin irritation and allow for movement. However, let me tell you what an elbow restraint is. Elbow restraint is more like a guard, elbow guard. And it's basically you put it on and you strap it on just using Velcro. It Velcros on and they can't bend their arm. So they can move their arm all they want to. Okay. They can move their arm. They can walk. They can move their head. It's not that they can't move their arm. It's that they can't bend the elbow. And so what it does is it prevents them from able to get to their mouth and mess around with it. The nurse is providing discharge instructions to the parents of a child who had cleft palate surgery, including information on elbow restraints. Which of the following statements indicate the parents understand the discharge teaching? The elbow restraints will help prevent our child from putting objects in their mouth. That's true. We should apply lotion under the elbow restraints to prevent skin breakdown. That's not a good idea. We need to keep the elbow restraints on for at least 6 weeks. I don't know how long they would keep them on. My best guess is that they would keep them on until the surgeon tells you that the incision is healed enough that they can take them off. So I'm not really prepared to tell them a specific amount of time that they have to keep that on. And I cannot imagine that it would take 6 weeks for that incision to heal enough to take the elbow restraints off. The elbow restraints should be loose enough to allow some movement. No, it's like an elbow guard. And so the only one that makes any sense is the elbow restraints will help prevent our child from putting objects in their mouth. That's the whole purpose of it, from putting objects in their mouth and even for getting in there and like scratching at it and stuff. All right, cleft lip and palate. I think there's a good chance you could get questions on that. When I think about the high frequency questions on the NCLEX, cleft lip and palate is not on the list of high frequency questions. Like I know you're going to get questions on who do you see first. I know you're going to get questions on putting on and taking off PPE. I know you're going to get questions on infection control methods and so forth. I don't necessarily know that you're going to get questions on cleft lip and palate. However, if you get them, might as well get them right. All right. I hope you have a great rest of your day. Thanks for watching.